It's like, look, there are some really obvious things that are totally fraudulent, right? So if you're in a hospital and if you're at home and there's a conflict, it's really clear, right? Oh, that logic extended to Doge if they had just gone after very obvious things that are really easy to like demonstrate to the public that this is clearly like a waste. It's clearly abuse, right? You can't be in two places at the same time. We have the data, like we know where you are, right? If they just kind of like focus on that, I think they would have won a lot more
Yeah.
support from the public. I do think it's important to say that, like, I think there's so much fraud and abuse going on in these areas that there are a lot of people in the, let's call it the ecosystem, who do benefit. So I think like finding a way to get the public support,
So there's an
right? Like,
interesting thing, Greg, that
yeah, go ahead.
I think you'll like this.
Yeah.
So
Okay.
in rural areas, sometimes some of those providers or doctors can get more political sway because it's that they know they've leverage with the insurance company, right? So
Mm.
that's where some of this happens. So, you find 100 million, but the insurance company goes in and says, hey, this is the only hospital that we have in
It's
this
the only
area.
option in Kansas or whatever. Yes.
I
Yes.
see.
Yeah,
Yes. Yes.
exactly. So
I see.
they say, hey, you can only audit me once or twice a year. If we lose this contract, if we lose the client,
Really?
then
They say
all
that?
the
You can only
employees.
audit me? They give like a
Yes,
rule,
if
like a
you lose the
number?
provider, yes, that's what happens. Sometimes there are
What?
providers that can become too big to kick out. Yeah, let me give you an example. If
I'm
your
actually
biggest
shocked by
hospital
that.
is
I mean, I'm not shocked by
committing,
that, but I am shocked by that. I'm sorry.
well, but I'll give you an example. If your biggest
Yeah.
hospital in the city is committing fraud, you're not going to get rid of the hospital. Well, not in most cases, if it is a regular, you know, you know, Anesu, Paul, whatever, Dr.
Yeah.
Anesu, whatever, and
Yeah.
they are
Yeah.
out there and they did not, they would be excluded and then they wouldn't be able to do business with the government and bill with the
Sure.
government. But now you're dealing with the biggest hospital that might have been billing wastefully a lot of money. And here's the thing, most providers don't have a lot of money. So let's say your local hospital overbilled you by $20 million in a year. You cannot just go and take $20 million from them. It doesn't work
Yes.
that way.
Mm.
So
They don't have
now
it
you
just
have to
lying
work with
around
them
on the
and
floor.
say,
Yeah.
hey, how do we continue providing services? It's a little bit of like, that's where understanding the ecosystem. So when you said, why didn't you just go and point? Why isn't Dodge like, hey, let's just go after everyone? It's because there are nuances to how those relationships work. And you have to be careful as to like, hey, sometimes there's provider abrasion. We don't want to have patients drop off. So it's a very interesting, it's an interesting area. I think this is going to be the biggest part. Today, J.D. Vance chaired his first, kind of like, meeting at the White House, and they actually found a special prosecutor, to try and, because one of the ways they think a lot of fraud happens is that, as we mentioned, some of the people responsible in power, right, aren't doing their jobs to see like, hey, why did we have a huge increase in behavioral health in thousands of percent over 30,000, in a short period of time? That should have been easier for the top law enforcement officer of the state to say, hey, maybe let's take a look here. What's going on here? But, so I think there's a lot of stuff that's going to come out. Who knows, there might be criminal, prosecutions that come out of this. But I think fraud, waste, and abuse is going to be with us probably going into the 2030s. There's a lot of demand for fraud, waste, and abuse. If you go out to companies in healthcare, in other parts of government, you're seeing that, people are trying to solve this problem. And I think that's a good thing, but I think we can do better.